Hello, friends. Today with us is Mr. Anik Nanda. He suffered from very severe trigeminal neuralgia for 7 long years. And in 2019, he was operated by our team at Pune at the microvascular decompression surgery or MVD surgery center. And he was cured of trigeminal neuralgia. He is going to talk about his experience of trigeminal neuralgia from the point of view of describing this disease in detail so that people get to know what this pain is like, which is also called as suicide disease, the most severe pain suffered by the mankind. Dr. Malti Panchawagh will be interviewing him. So let us see what Nick has to say.
Namaste. I'm Dr. Malati Panchawagh. I'm an anesthesiologist and a perioperative physician at the MVD Center in Pune. Today we have with us Mr. Anik Nanda.
Hi, namaste.
I should say he is an ex-patient of trigeminal neuralgia. And I'm very happy to say that, I'm sure so is he, that he is no longer suffering from trigeminal neuralgia.
Yes.
He underwent surgery with us, which is the microvascular decompression surgery in 2019.
It was 2019. Yeah.
And
MVD.
it's now 5 years since the surgery.
5. Wow. Doesn't
5 wonderful years.
It's been 5 amazing years. When you think back to it, it's like, wow, 5 years really passed, and it's like, because you get back into normality. Normality of what we experience as humans, where it's sort of pain-free and you're not under this stress 24/7. So surreal, definitely. And then to reflect back on that, like you said, 5 years, wow.
Yeah.
But definitely been a wonderful 5 years, yes.
So today, since he's here just to say hello to us, we thought we'll have an episode with him so that he can share his experience of the pain, how it was, how his life was turned topsy-turvy because of the pain. And hopefully his experience will be able to support someone else during their dark times and give them a ray of light, that there is hope. Let's listen to what Nick has to say. So,
wow. Yeah, sure. Well, where do I start? I mean, when you're presented with such a pain, it introduces itself in a very I would say conspicuous, sort of hidden kind of way, because for me it creeped up sort of like a dental pain. It seems to be quite a common theme amongst us patients.
Yes.
And for me it was
on the left side.
It was on the left side, and I was so sure that it had to be rooted in one of the teeth or in the gum. I knew it was something to do with a dental issue.
How old were you when you started the pain?
I can't pinpoint exactly, because you know what, it was, again, you're not too sure about what exactly it was, but it was around, I would say, about 22 to 23 years old.
Young.
Yeah. But I don't think I took the pain so seriously, or the condition so seriously, when, obviously in its initial stages. And I remember, having gone to the dentist a few times and saying, it's still not solved. There's still a pain. There's still this. There's still that. And the dentist was saying, I'll do my best. I'll try my best. And and my dentist, is very experienced, and she really did do a great job. But at the same time, she did inform me that, which I was completely unaware, but that all dentists, or at least most dentists, have been educated, or at least even if it's a chapter or so, on what trigeminal neuralgia is. And she's like, there's a potential of you having this brain condition called trigeminal neuralgia. I was like, no way. I'm 22, 23 years old or whatever. There's no way I can have brain surgery. And that's your first reaction, is denial. You don't want to accept something that, it can't be me, surely. I mean, no. So she said, we will continue to see if there's any dental root to the pain. But on the side, why don't you go and just have an MRI, or was it MRI scan and CT scan?
Correct.
Like that. So I said, sure, no problem, kind of thing. But in the back of my mind, it's like, it's definitely not that. So I told her, I remember even saying, yes to the dentist, I'll go do that. But I was just thinking in my mind, I want to wait till I get back to the next dental session and it's just gonna get sorted. But the pain starts to, I would say, intensify, and then it starts to become more frequent. And once the frequency increases and the intensity increases, um, and it feels like it's spreading.
So how would you describe the pain that you had initially?
So initially, I would say in the initial stage, it was definitely more of a. I felt more of an tooth pain, and it wasn't quite an ache. It was more of like a, and it wasn't quite that shooting sharp pain that it obviously became.
Eventually became.
But it certainly was between the ache and a sharp pain, and I knew it was affecting me even when I ate. But I was like, I'll just eat on the right side, I'll be fine. How bad can it really be? And it'll be sorted within, the next
Because
few
at that point
sessions.
in time, you kept thinking it was dental pain,
Sure, yeah.
and you didn't want to be,
Yeah.
thinking otherwise.
No, definitely not. And you reject the idea of the worst case or whatever. And you're like, okay, and in a lot of situations, you're always rationalizing with the worst case. You're hoping for the best, but you're aware of the worst. But then even if you land somewhere in the middle of the two, you're still okay-ish. So obviously, when you're presented with the worst, you think, no way, no way. But then, I mean, I think with the more frequency, even the dental visits became more frequent, and then the dentist was like, you're gonna have to just get the MRI done. I'm telling you that this is possibly a trigeminal case here, because I can't see what more I can do on my end. So I went in for the just so that I was still reluctant.
So you weren't still on medication yet.
I wasn't even on medication. So I was still back and forth just to go for a scan. Can you imagine? I mean, something as simple as a scan just to find out. And just to touch on this topic of when it comes to any kind of medical, I would say a lot of us, I don't want to speak for a lot of people, but at least in my case, you kind of you don't want to take trips to the hospital, or you don't want to go to the doctor, or you don't want to be confronted with these realities because, you just, I think a lot of people like to just, even if you've got a cold or a flu or whatever at home, your first thing is, I want to just sort it out myself rather than having to take an injection or some other prescription
So there is a hesitation
tablets.
going to the
There's always
doctor
that
seeking
hesitation.
medical opinion.
Absolutely, yeah, absolutely. And then I think finally when I did do the MRI scan and things, that's when
that was a few months down the line.
That was a few months down the line. I would say, many months. I'd say, definitely more than a few. And
so you suffered the pain, but you did not get the MRI done because you never thought it was possible.
Never thought it was possible. And I thought this was just purely a pain in my mouth.
And what did the MRI show you?
And then, yes, so the MRI shattered my perception of, understanding that there was a mouth and pain internally in the tooth. And what it showed was a vascular loop, which was basically showing the vein and the nerve, the trigeminal nerve, fifth cranial nerve, whatever, creating friction.
Yeah.
I didn't understand all of that at the time, but it showed the vascular loop, and I was like, okay, I mean,
so did you go back to the dentist?
So I said, I went back to the dentist, and I said, there's a possibility. After coming up with the scan, I think one of the doctors said that I need to get this seen to by a neurologist, and I think the dentist just had to say, your next option is obviously is a neurologist. So, which I mean, obviously had gathered from the scan. So I said, yeah, of course. And then
all this happened in the UK, or was it?
This actually happened here
in Pune.
This happened here, very much here, because I had moved at that time from the UK to Pune. You live your whole life up until 23 years old, completely like physically sort of normal. Exactly. I didn't have any other issues as such. I remember, I guess maybe when I was 4 or 5 years old or something like that, maybe around that time, my mom would be able to tell me properly, but I didn't have very good hearing. So I remember I got these grommets that they opened up my ears and they put this grommet in. I think that was the only kind of actual real surgery I've ever had in my life. And other than that, I never had any bone fractures or anything. So hospital trips weren't really usual for
Frequent.
me or frequent for me. Um, so the usual was just going to the doctor for some tablets that you'd get a fever or whatever.
So you went to the
Um,
neurologist.
Right. So then I'd gone to a few of the neurologists, and you get so many other opinions on so many different things. But when obviously they're all cohesive and saying that this is trigeminal neuralgia, so then you're
They
like,
started
okay,
you on meds.
you're diagnosed, and then it's about accepting obviously the diagnosis. So you go back onto Google or whatever onto your internet, and you start searching all about trigeminal neuralgia. And obviously the internet sometimes is not always the best thing because it scares you.
It's a black hole of information.
It really
It
is.
just sucks you in.
And then your brain starts to nitpick it, or at least like pull out certain information that can sometimes be not even relevant but scarier. Or sometimes like, for example, if you were to just have a common cold and you would type in some symptoms of a common cold, they would be like, or like a sore throat. They could be like throat cancer or something. So your mind wanders to the worst.
So Google University is a very large university.
Yeah. So I think that scared me more because obviously reading about trigeminal neuralgia was worst pain known to humans and suicide disease and all these different things. And I'm like, but hang on, I'm getting pain, but surely,
He's not that bad yet.
is it that bad? I mean, it is bad, but like, is it the worst pain ever known to someone? Oh, surely not. Maybe it's just Google and things like that. And then, like, just how you normally assume the Google University kind of thing where, there's always just the worst thrown at you. But, you do some more research and you talk to neurologists and things. And I think at that point, a couple of years in, my mind's a bit blurry on the time frame from when I initially started getting the pain to the dentist to then neurologist and medication. But let's say about 2 years in when I started the meds, because I remember the first year at least there was no meds, or it was just like the pain, I was suffering with it, and that was it. So I think maybe in the first 1 or 2 years when I started the meds, I was like, oh, you start off on a smallish dose, and throughout the day, so your body reacts well to it in the initial stage.
So initially your pain was just a couple of times a day?
I would say initially, I think by the time I started the meds, it was more than a couple of times a day. I would say before the meds, it was only, it was much less, maybe a couple of times a day. But once I actually said, no, I need meds, is when I realized that this is becoming more frequent in the day. But once I started taking the medication, your carbamazepine, oxycarbamazepine, and Tegretol, and everything basically, from pregabalin to Gabapenting, Gabapenting. Sorry, it's all coming back to me now. Yeah. But when you go through that, no, so I started small dosages, and it worked fantastically. And that's when I thought, wow, okay, I can get through my day. I can pretty much, go about my day, no pain, I'm fine. Right. That's a great.
Yeah.
And then you start thinking, you're untouchable. You got the meds, and then you start forgetting about the pain. But then reality hits again and says, you know what, your body's now used to these meds. Hang on a second. The pain starts becoming
raising
more
its head
intense.
again. Yeah.
And you're like, wait, but I've taken the same meds. And then what's happening? Why am I still feeling now? Why am I feeling even more crazier pain? It's so much more intense. And you go back to the neurologist, and the neurologist says, okay, now it's time to up the dosage. And then this cycle kept continuing where I was going back and forth. So I would up the dosage, and it would say if it was 1 in the morning, 1 in the afternoon, 1 in the night, it became 2, 2, 3, 3, 4, 4, 4, till like 5, 5, 5. So I had reached maximum dosage of like 5 in the meds in the morning, 5 in the afternoon, 5 in the night, and then that's not even taking into account the self-diagnosed or whatever off tablets that you just wanna pop it like on top of, let's say, your oxycarbamazepine and all that stuff, that cocktail of all of those medicine. Then you pop a pregabalin in the middle, just to
keep
also
things going till the next dosage is
till
due.
the next dosage. Yeah, so you take dosages to get you to the next dosage. And I think I reached that point where I was like, wow. And so my body kept basically getting used to the meds, and the pain was only getting more intense.
So did you also notice that there was a change in the character of the pain during this time?
Absolutely, yeah. I would say the pain became, it was unbearable, honestly. And at this point, when it was changing over, I was feeling everything. I was feeling like it wasn't a tooth pain anymore. This was a serious nerve pain where I was like, there was different pressure points on my face. I couldn't brush my teeth at one point. I couldn't speak properly. The fan or the AC, that was 100% nervous. If I had the AC on, the cold air itself, if I would breathe it in, or if it would touch my face, immediate trigger. The fan, wind hitting my face, immediate trigger.
So how did you actually manage to eat and drink and talk and shave?
And shave, yeah, and even just yeah. So I mean, to try and experience just your normal day to day, which you would find essential, to shave or eat and brush your teeth and things like that. I guess I would have to say I would just wait till the meds kicked in for that short period. But there was a point where I had reached the meds weren't doing anything for me. So I remember that even with the meds, I was brushing at a pace that a normal brush session would take anywhere between, I don't know, a couple of minutes to 10 minutes, let's say, depending on how thorough someone is. I'm not sure 10 minutes is probably a long time. But for me, it would take, 20 minutes just to, it would be
to
like,
gather the strength to actually,
yeah,
go to
because
that side.
you're pausing, you're stopping, then you're like going through the pain again. My eyes, obviously, your body's like bleeding out, and when you can't scream no more, or the pain is too intense. Your eyes start watering. You start like, your body starts reacting in a physical way of just from reacting to the pain. So you start sweating. You start like, yeah, like basically crying, but like just
I know.
and
Tearing up.
just tearing up, and you're just sort of in that zone and trying to focus in on the pain. It's like you're remembering what you go through.
It must be
And
stressful to just think about those things now.
Yeah,
Stressful to go through it for sure.
definitely.
To talk about it.
It's stressful, emotional, definitely, because you go through so many emotions in that period of time. And
how was your personality during this time? Or what was your psyche? What emotions did you go through all those years?
That's a great question you asked, because I wouldn't even be able to give you a straight answer of what my personality was like, because I wouldn't even say I was fully myself. The meds combined with the pain and the meds, I think I was sort of like living this double life where first it was a half life, because you're half paralyzed and zombified just from the meds. So your mind is numb, your body is numb, and again, these tablets, they can't just focus on the pain here, yeah, focus on the whole body. So your body shut down, and your mind then takes a toll, your mental health takes a toll. So I didn't even want my close people around me feeling sympathy for me. So it was only until like years later, when I elected to go for the MBD, that they even knew or heard about trigeminal neuralgia from me. But during the stages going in, I'd isolated myself. I didn't make it very well known amongst my friends. A lot of people that I used to go out with socially and things like that weren't even aware that I'm suffering, because you try and put on this brave face or whatever. But when I say you lead this double life, it's also because you're putting on this brave face or whatever when you're going out. You're trying to forget it, even though the pain's there or whatever, and you've taken your meds. But then at home, you're going through these other moods that, which is sad, because your family has to take that. Your mom, your dad, your sisters.
So you were irritable as well?
I was very irritable. I was impatient, irritable. I was snappy, and it's sad because you would take that out on your, the ones that you're at home
people
with.
who are actually supporting you.
Yeah, and then you go out and then so it's sad to think about it that way. But obviously having such a wonderful family to support me through those times and be patient with me and understand, at the time, obviously, you don't appreciate such things, but it's about taking a step out of that world and then looking into it and saying, wow, so when it comes to the personality front, I wouldn't be able to give you a firm answer of where I was as a person, because you're just lost a lot of the
Were you
time.
able to enthusiastically participate in hobbies that you enjoyed? You're a painter yourself.
Yeah, that's right. At the time, I used to paint a lot, actually. And while I do still till this day find a creative outlet, I'm a creative at heart, so I try and find any outlet that I can. And I do find that my mind goes into a creative space. But at the same time, yes, it does hinder a lot of things. At the time, it not only hindered, obviously, it hindered relationships, socially, at work, professionally. Um, uh, you're even romantically, and it's not like you want to sit down and discuss with every single person what trigeminal neuralgia is. I mean, at that time when you're going through it, you don't want to talk about your pain and experience
It's an
the pain.
effort, exactly. So it's an effort to deal with it yourself and then to share it and explain it all to somebody else.
But I would still say that if maybe I handled that wrong, and I understand that seems to be like, people have that tendency to not want to deal with that. But if you can and help, do talk about it, it actually helps others understand it and helps you sort of accept it more. And I feel that's where maybe I went wrong, because like now, I mean, obviously having come on the other side of it, I would want more and more people to understand and know that, you don't have to suffer with this pain alone. Let's recognize the pain. Let's understand what trigeminal neuralgia is. Just as much as the next man, if you ask someone, anyone, you pick a person on the road right now walking around or whatever, and you say, do you know what cancer is? Or they'll know cancer is a deadly thing or whatever. But they've heard of it, or there's some sort of, you know what I mean? But I want just, where people know just as much as what a common cold is, or what cancer is in this world, or they should know what trigeminal neuralgia is, because it's not just about you as a patient, but if other people around me knew what it was, maybe I didn't have to suffer for 7 years. I suffered for a very long time, and it took a long time.
So you must have done a lot of research on your treatment options, the options that were available to you.
Absolutely, yeah, definitely. I did. You get all your research under your belt, and you think, what's the your mind automatically goes to what's the least risk, what's the least invasive, what's the least way I can get out of this, and without having done surgery. And I think we as society or humans or whatever, we always tend to, at least from when I talk to my friends and family about it, that we always try and say, oh, avoid the surgery, the better, the better. And that seems to be the general.
Yeah, it's the least harmful of all.
Yeah, but actually, you could be doing yourself more harm than good by telling yourself, oh, what's the other options apart from surgery? Because actually, there are capable people who are experienced, who are their abilities and skill is, heightened to another level, where they're doing surgeries in and out, such as yourself and Dr. Panchawagh, that you have to put your trust, your own trust, not just in other people's hands, but trust your own decisions as well. To say, you know what, actually surgery is the best way. And obviously there were options. Like, I mean, coming back to your question, what were my options at the time was that radio frequency. That's right.
So at some point you were actually also considering radio frequency injection, but
yes,
you decided against it eventually.
Yes, definitely. I considered all my options, and that radio frequency was definitely one of them. I remember having read that it was effective in the short term, not quite the long term, and also I think the procedure wasn't quite
as
appealing
efficient,
to me, and efficient as well. Yeah, that would be the right word as well. With sort of the needles being stuck up, for some reason, I don't know why, it just didn't appeal to me. And obviously not being a long-term solution, which meant that I would have to keep doing it, every year or whatever.
You could only do it a couple of times, not more than that.
Oh, really? Okay.
Eventually, you would have to land up with surgery.
Right, yes, yeah. Oh, yes, of course, yeah. So it would have to be a few times you get it done, and then at the end of the day, you're still coming back to
Not even a few, because the first couple of times it works just as well,
right.
but eventually it doesn't. It stops working.
Stops
Its
working.
efficacy goes down even further.
Right. Oh wow. Okay.
So you're left with the option of surgery.
Right. And
So why not choose it right at the beginning?
absolutely. If it's I think it's sort of human nature sometimes where you're presented with the solution to say a problem or whatever, but sometimes we go all the way around trying to see what else we can to land back to exactly what we were presented with in the first place. And I guess it's well, in my case, I would say it's a combination of denial, procrastination, self-sabotage, which is a deadly mix because I don't want necessarily, I didn't want to bite the bullet to get the surgery done. I wanted to, again, just stretch out forever, however
Delay it,
long,
yeah.
delay it, if and maybe just go without it. But reaching a point where I'd maxed out the meds and I had, and then on top of feeling like a zombie and taking a toll on my mental health and physical health.
You're
And
feeling
then,
miserable almost all the time.
oh,
I guess.
100%, yeah, miserable, never knowing when it could come, and then when it comes, it's so intense.
So would it be safe to say that living with pain was one thing, but living with the fear that the pain would come any minute was equally deadly?
Equally deadly, yeah. It's so crazy. Such a I can't even find the right words to describe the feeling of what you're thinking, what you're going through.
Living in
That's-
apprehension all the
Yeah,
time.
living in the apprehension, living with, obviously, like you said, because of the fear of the pain, coupled with the pain, as well as the meds, when they're doing their side effects, and all that jazz. It's definitely, I would say, taking a toll on mental health would be an understatement. I mean, because you get into a serious state of depression. Um, you do have. I know it's nicknamed the suicide disease, but you do get suicidal thoughts, not just because you want to kill yourself to put yourself out of the pain, but like the meds themselves can have that effect on you, and you just start thinking like, how long can this go on for? And but once you really study, at you're well informed, whether you're doing self study or you're getting educated from a medical professional in that field, a neurologist, a neurosurgeon, and you're really understanding, then I think things become clearer in that there really is that one logical, rational solution to it, being microvascular decompression, the MVD surgery. It's about literally about taking care of yourself, what's best to approach such a condition for the long term, and you don't want to have something recurring, whatever. And you have to weigh up all your options and say, you know what, would you rather continue life living like this, but you're still doing damage to your body and your mind? Or do you want to, and there's risk in everything you do. Obviously, invasive surgery has its risk. There's a risk you cross the road, to get to the other side, especially, with all these bikes going on. There's a risk in everything. Now, obviously, yes, this is a direct risk. You're getting treated in the brain, but it's a risk well worth taking under the right hands.
So when you first met Dr. Panchawagh,
I think when we first met, I think we had an instant connection because not only was the communication quite open and you know it was also about, I had done my own research on trigeminal neuralgia, and obviously understanding the pain and going through what I'm going through, and then for have someone to relate to that, but not actually be a patient of it, um, and then to help me understand not only about the condition but the surgery that goes behind it and what we're doing it for and what it entails, and you know these are your options. It's not like I was getting sold something or the other. It's about, okay, here is what you're dealt with in life. It's your choice now to go ahead. And I think I felt an instant warmth and comfort with Dr. Jaydev Panchawagh. I think I don't think I know. I definitely felt the connection instantly, and I know that having also done my own research on Dr. Panchawagh, just when you wanted to see some
Mm.
stats or some figures
Sure.
about like
Mm.
how many surgeries he's actually done in this arena, and his YouTube videos and the way he talks about it, and so passionate about obviously helping the community and getting and being so skilled. I think it would be doing a disservice to him and the rest of the community and other patients to not sort of raise more awareness about this, because it's so important. And I think more and more people need to know both about trigeminal neuralgia uh, and about MVD, and getting MVD done, especially from a team like yourself and Dr. Jaydev, is
So
I
even
think a
after
complete
you
winner.
met him a couple of times, you still weren't sure about the surgery.
Yeah, apprehensive yeah, I mean, definitely. Again, it was coming back to delaying, and even though I knew that that was obviously the right option to go about, and I had understood exactly what, after having just gone in depth about the surgery and about the condition and about openly talking about what the options are. I
So
think
you met him several times, and then slowly it sort of dawned on you that this is what you got to go for.
there was a period in between. I think it was a few months even that from the first to the next meeting where I said, I know this is the right option, but I'm still gonna just see how I can ride out on, because you still try and tell yourself, you know what, maybe the meds are fine, maybe you don't need to go through surgery. But it's only once you actually take that leap of faith and you actually uh, you actually make that well informed decision that this is the right way to go about it, is only when you realize. And I think I knew that obviously if I was going to do the surgery, it would, in my mind there was no doubt that I wanted Dr. Jaydev to do it, to do the surgery.
But the question was whether you wanted to undergo the surgery.
It was whether I wanted to. Yeah, definitely.
And so what were your final thoughts before actually going under the knife?
So I would say definitely years before going under the knife, it was like, no way. Then months going up into the months before, it was again the back and forth. But then actually the final moments, I would say it was a whole different. I taken a more playful approach to it.
And there is hope that you will wake up without the pain.
Absolutely. So I remember that in my hopeful sort of positive attitude towards the surgery, in those moments coming up to it, I remember cracking a few jokes here and there with mom and dad, which are borderline inappropriate, where I would say, if I do die on the surgery, just please don't, you burn the bodies. So I had mentioned one place, please don't take my body here.
Okay.
I would start like joking about where I wanted my ashes, and they're like, please don't talk like this. I'm like, I understand, and I'm not, don't mean to hurt your feelings, but I also want to be a bit playful with it, because at that point I really accepted that, you know what, and the reason why I was so joking about that is because I was so confident in Doctor in this team that I knew I'd come out of it fine, and that it was just such a build up to get there, that I was really hopeful and positive that I, I was assured, actually, in my own, it's like self assured that this is going to be just fine. And
so when you wake up from anesthesia, what magic did you experience?
well, you know what? A lot of people will say, after they've gone through a surgery or some sort of thing, that there's minor pain here and there, whatever. Or and I would say yes, that is the case. But for me, I think for the which was the most uncomfortable wasn't the pain after the surgery, or the you know that the discomfort. I mean, obviously you have pipes going through you.
Yeah,
You had
throat
pipes going,
pain, and
so I did feel it was inflamed. I did, swallowing also was that you could feel the pain, but no pain up here, because that's all still numb from the anesthesia and stuff. But I think none of that bothered me, actually. I woke up and none of that bothered me. The only thing that bothered me,
catheter.
the catheter.
I knew it.
The catheter was the only thing that bothered me, and I just couldn't accept. I tried my hardest to be comfortable with it, and I even remember the nurses saying, "But you've gone through brain surgery, you've gone through so much. What are you
Yeah.
worried about this? I said, I don't care. I want the catheter out.
Out.
And they're like, listen, we have to do a test in front of a doctor that you can at least walk straight. So you have to stand up, walk to one
To the
end and come
bathroom,
back.
come
And if
back.
you can complete the test, then we can think about taking the catheter off. This was in the first day. I was like, I need it out. And I was like, I'm just uncomfortable. And I think the thought of that and just knowing that that was for me. And I think I remember I'd made sort of friends with the nurse who was attending to me that I cheated a little bit on that test because I couldn't fully hold myself up, but I was like holding her at the back and trying to walk. And I told Doctor, see, I passed. And he didn't see my hand was like being supported. And then I think they agreed, like, okay, just take it out if he's really uncomfortable with the catheter. But I think that was the only thing for me. And then I remember, obviously, the aftercare and just basically trying to get back to normal, but still not like rushing into anything too much. Still using those 2-3 months, I would say, even those couple of weeks.
So your pain went away immediately
It
after
was
surgery?
instantly away, 100% instant. It was obviously you get still the numbness from the side effects of the anesthesia and stuff, but you would rather take that any day over
The
pain
pain.
or whatever. So that was completely fine with me.
And your medicines also were tapered off?
They weren't even tapered off. I mean, it was a hard stop. I didn't take one single med after the surgery. I would say maybe leading up to the surgery. Actually, I can't even say leading up to the surgery was tapered off as such. I would say yes, I had already stopped the carbamazepine and the Tegretol and all that. I was on pregabalin. But again, I was overdoing the pregabalin, I remember. Right up until the end, actually. So, I wouldn't say fully tapered off, but it wasn't even like I needed it as it didn't even come to my thought. Like, I was...
So how was the relief from the brain fog after surgery?
Oh yeah, that it's...
Everything was more clear, wasn't it?
Absolutely. I got a new lease on life. I felt like I got a new perspective on just a new outlook on life. That, like you said, the brain fog, the mind fog, just it's lifted. That burden's off your shoulders. You can see clear. You can actually get through a day without saying, "Hang on, like, wow, I can do something as simple as touch my face, or brush my teeth, or just like smile." Like I couldn't even fully smile. You would like I would be like, "Ha, don't make me laugh," because I don't want to extend it. Like I couldn't,
So even you would talk or eat without the lips touching each other.
The lips touching each other, or even like as far as saying like stretching one portion of the cheek back so it triggers something else. So you're basically walking on a minefield here, and literally like eggshells where you're trying not to let anything crack, but you now know what your triggers are. And I had certain trigger points on my face.
So after surgery, just being relaxed, that you don't have to be mindful of these small unconscious things that we do.
Yeah, absolutely. But you know what? I would say in my case, I took a little time to adjust where I was like hesitant on still putting the toothbrush in my mouth. So I remember putting the toothpaste on. I put the toothbrush in my mouth, and I was going slowly, and I was like, will it trigger? What if it does? And then you would test it a little bit, then you would go back to what you're comfortable with on the right side. Then you would test it a little bit, then go back to the right. Like, well, maybe there's no pain there. There's no pain here, and you just keep going, and then you realize, wait, hang on, so you're pain free. You're living a pain free life, and just enjoy life. Don't think about it, because, like I said, you don't miss the pain. You definitely don't miss the pain, because the pain is unbearable.
It's difficult to accept the fact that you have no pain anymore.
Yes, that's it. And then you start wondering, where is the pain? Like,
because it's been your companion for so many years.
Yes, your companion. I would say better word, imposter. It was an imposter, and it was an imposter that wanted to stay that pain. And I'm glad that.
So, have you experienced any pain at all since the time?
I can happily touch wood, and all the wood there is in the world. say that I have not experienced a single bit of trigeminal pain since the surgery. And honestly, it was a blessing. And it's always that in hindsight where it's like you once you understand the right choice, what if you just made that choice sooner? Um, and yes, it would have been nice to experience more pain-free years in my 20s and early 20s, but it's okay. You learn, you go through life, and I feel like there are no regrets because I wouldn't be the person I am today or strive to be. Um, having gone through those different moods that I was in, those different personalities that I went through, the different, the pain that you suffer with, and the hardships that people don't understand, and I firmly believe that not all disabilities are visible, and today, um, you have the disabled bays or whatever, parking spots, and then you get out and someone's got a wheelchair or whatever. And some people, will park there and they have maybe other disabilities. And it's about raising awareness to all kinds of, and I do say a trigeminal is a disability. I do firmly believe it is a disability because of how I felt disabled, uh, not both in physical activity and mental activity. I mean, your you can't your brain is like your brain your thought process is blocked because you can't run away with your thoughts and ideas that you would like to explore without thinking this pain's gonna come back any second now. So that's hanging over your head like a dagger, like a sword, or and then obviously physically, like I said, I mean, there were certain moments and certain parties or social settings that I was in where I'd fallen down to my knees, and it was and even if it was just for that 1 minute or under a minute, you're in intense pain, and then you're suddenly back to normal again. But social setting, everyone's like, is everything okay? And you're like, you know what, I don't even want to talk about it. Let's just continue and have a good night, because you don't want to draw that sympathy, or I didn't want to have that attention unwanted. I just wanted to try and just live a normal-ish life as much as I could, and so that's why I felt like it was very much a disability in many ways. And
So you believe that it's essential to spread the message about awareness of trigeminal neuralgia and the treatment options available, and that the MVD surgery itself is not as scary as
oh yeah,
one thinks it to
100%.
be.
Yeah, 1,000%. I completely agree with you. Creating awareness about trigeminal neuralgia, and specifically treating trigeminal neuralgia with MVD, I think is so crucial. And I think, and not just crucial for patients suffering, like I said, it's for the wider community, because you can start, today if someone's got, someone who's not in the know has got whatever condition it is, like today, what a cough and cold is, or why don't you take $1 for the fever, $1 tablet for the fever. So some people now know, based on that condition, and they can help others. Oh, I think this is the best medicine. I'm not saying don't take medical, but just the general knowledge of knowing what a condition is. Always seek the professional help.
Sure.
But it's just raising awareness amongst everyone, not just the patients, but like others, so that in case it occurs in their family, they know, okay, you know what, let's not waste time with this. This is the right way to go, and let's attack this head on. And fine, yes, surgery can be daunting, it can be scary. When you talk about invasive brain surgery, your mind starts wandering all kinds of places, but it's the most important thing to say to yourself, you know what, like, you want to take utmost care of yourself first in terms of health. You don't you or the next person that you love, and this would be doing something or to someone that you love by telling them to go for surgery, not the other way around. And I know we tend to not want to elect for surgeries and things, but I think that thinking has to start changing, and the fact that we are talking about it and creating more of a conversation about it, I think
So you know Dr. Jaydev Panchawagh now for several years since your surgery, and
Right.
maybe a year before that.
Yeah.
So how have you found his approach to trigeminal, the surgery, the team that he works with?
Yeah, you know what? I honestly, I've couldn't be happier. I'm sat here now, what, 5 years after my surgery, um, and I feel nothing but love towards the team, Dr. Jaydev Panchawagh, yourself, and it's a real journey, and it's a decision that you make that you're never gonna forget in your life, and it being the toughest but best decision you can make by electing for the MVD surgery, but also a team such as yours and Dr. Jaydev's um, is it's not every day where you can you don't get if you can find a team such as this, it's really something special. And for me, I feel blessed to have had the opportunity to meet with you, and then ultimately go through the surgery with you, and now to sit here even years later and talk about it. And
Yeah.
I think that's so important, and it means a lot to me to be able to. I was telling Dr. Jaydev just before we sat, and I was saying, was appreciating the videos that he makes on YouTube and things. And I said, and we were talking about the pros and cons. Obviously, a lot of cons on the internet. There's a lot of pros and a lot of cons outweigh the pros or whatever. But one thing of a good pro of the internet is obviously you have a wider reach to a wider audience. And even if there's 10,000 views or 100 views, whatever, how many of you, whatever it is, if you are at least changing that one person's life, just one person out of like 150 views or 10 million views, if you're even changing one person's life for the better, for them to then come and seek your help, understand more about trigeminal neuralgia, understand more about MVD, and then understand about your technical ability and skills, and then to ultimately elect, it's worth it. It's worth it all. Honestly, it's worth it. I think my advice to anyone who's watching, if talking about it hasn't convinced, or at least
set your thought processes.
Yeah, if it hasn't set your thought process yet on the path to MVD, then just come and meet the team and understand what the surgery is, what it entails, what the condition is in itself, and what you're going to be putting your body through, and the pain you're going to be suffering if you don't elect for the surgery. And coming from someone who suffered with it for almost 7 years, and been at the worst of it, maxed out meds. I mean, my only advice is come as soon as you can and act upon it as soon as you can, because I can tell you, so that you don't have to go through the pain and suffer with it for as long as I did, that you can attack it now and come meet the team, understand it, and elect for the surgery, because your life will be so much better, and you can live a full and happy life. And I'm grateful. I'm grateful to you start wondering, how can the universe put this condition on me? And I and especially with this condition, I remember reading about it, and also you had mentioned that 40 to 60 is kind of the age bracket where it seems to be more common. And I was in early 20s, and I remember reading this thinking, I'm so young. How is this happening? Why me? Like, surely not. I mean, what, like, but again, no regrets, because, if the universe chose to put me through those conditions for me to come out and want to be, see the world in a different perspective, in a different way, in a more positive light, approach it in a different way. I think it's everything's been worth it, honestly. And I can safely say I'm
out of it all now.
Out of it all and leading a very positive life, yes. And not that I wasn't leading a positive life earlier, but a pain-free sort of experience, and just can actually live a full life, honestly, really. I mean, I can't stress that enough, because, when, like pain, like you said, the pain, the med, the fear, all of that, It's a deadly combination, and I would just don't want to wish that upon anyone. So if we can, um, spread awareness and just make as much noise about this as possible, I'm all for it.
Talk about it and let more people know.
Absolutely,
So that's
absolutely,
essential.
definitely.
Well, thank you very much, Nick,
Yes, of course.
for
Yes.
being with us today
Thank you for having
and
me.
to share your journey and to share your thoughts. I hope all of you liked this episode. Do let us know if you have any more questions about this disease. We'll try and make more videos, educational videos about those subjects. And thank you for watching, and do like, share and subscribe to our channel. Thank you.